This is your lecture on the concept of infection. Within the concept of infection, you have these exemplars: asepsis, healthcare-associated infection, and urinary tract infection. So I've listed out your learning outcomes. This is the information I want you to be able to retain after listening to this PowerPoint and reading your chapters and just basically learning the content for infection. The last outcome here, number 10, is actually a skill that will be practiced both in the skills lab and in the in-class face-to-face meeting. But I want you to really pay close attention to all the learning outcomes when you listen to my PowerPoints, because these are very important and where your exam questions will be coming from. So like the other lectures that you've listened to so far from me, you will note that I always try to start the concept by a definition. Okay, so think about this definition on infection. Something gets into the body and causes injury or toxins or the antigen-antibody response, which is also the inflammatory response. And clinically unapparent might mean non-symptomatic, or you might have cellular injury. So think about COVID-19 today, right? So it is an infection, and in some individuals it does not clinically show up, and in others it causes a lot of injury or damage. This cycle is an important piece of the concept of infection. Again, think about COVID-19. I've put together an entirely separate PowerPoint on COVID-19 because there's so much important information, but I want us to think through this infection concept and think about how these components, or the six links, 6 steps, pieces to the infection cycle, how they impact us, right? So you have number 1 is the agent. You have a pathogen, whether it's a bacteria, a virus, or a fungus, or a microorganism. The second component of this cycle is a reservoir, and basically that's where the organism lives. The third step or component is the portal of exit. Somehow that organism needs to escape the reservoir. Like, for example, a sneeze is the portal of exit in a respiratory type infection. Number 3 is, I'm sorry, I just said that. Number 4 is the means or mode of transmission. An example of that would be airborne. And number 5 is the portal of entry. So at some point, that organism needs to get into the new host, which brings us to the last step, the susceptible host. That organism gets into the host and starts an infection. This is called the infection cycle. I love this picture. I'm a visual learner, and this helps me a lot, and hopefully some of you are also visual learners. If not, hopefully you can tolerate my pictures. But the infection cycle we just went through on the last slide, you have the agent, the reservoir, the portal of exit, a mean or mode of transmission, and the entry into that next person, or lastly, the susceptible host. Well, look here at all the different places in this cycle, in the infection cycle, where we as healthcare providers can break the infection cycle. And this is, we have a learning outcome number 2, describe the nursing interventions used to break the chain of infection. And you can see all these different interventions, right? Sterilization or use of disposable supplies, good hand hygiene, cover your nose when mouth when sneezing. So all of these different interventions here, symbolized as the scissors, are representing how we can break that chain of infection. Another visual for you to be able to understand this piece of the concept, I've dedicated 3 slides to this infection cycle, so I hope you understand that that's an important piece of this concept. It's extremely important to understand the science behind it, because everything we do in managing our clients, all of our interventions go back to this process, this infection cycle, and how we prevent infection, how we prevent the spread of infection. Let me replace that. How we prevent the spread of infection. Hopefully by now you realize this course is all about how we manage our clients, what our interventions are. So once you understand the process of this infection cycle, then it can help you understand what our nursing interventions are to prevent the infection in our cycles, in that cycle, excuse me. Our goal is to break the links of the chain to end the infection cycle. As the nurse, you need to pay close attention to this portal of exit piece of the chain, right? So if you see here, underneath portal of exit, you'll see secretions and droplets. And when caring for patients that have, or clients that have GI or gastrointestinal or respiratory infection, you're going to be paying attention to minimizing those secretions or excretions that exit the body, right? So paying attention to these body fluids, basically. There's a great table in your Hinkle book, table 71-1, that talks about the disease, the organism, the mode of transmission, incubation period. Take a look at these and take note on things like the diarrheal diseases, right? So you're going to come across something called Clostridium difficile. It's also abbreviated as C. diff, or Salmonella, or Shigella. These are all the organisms, and they have different modes of transmission and different portals of exit, right? So C. diff is mode of transmission is the fecal oral route. So the exit portal of that organism is the GI tract or the rectum. And the entry portal for the susceptible host is the mouth. So the mouth orifice. So you hear the fecal oral route. That's what we're talking about. As opposed to something like the Ebola disease. So the Ebola virus is transmitted through blood and body fluid. So the main portal of exit for that Ebola virus is through the body, through blood and tissue, like as depicted here in the right-hand screen. And the main portal of exit for COVID-19 is the respiratory portal, or secretions coming from the mouth or the nose. Okay, I hope that explains it a little bit better, kind of clears it up. Another picture talks to, or you can take a look at the different types of infectious agents here and where they might be impacting the body. Our third learning outcome is for you to list the stages of infection. It's important for you to know, because you need to know where in the process of the infection is your client. Where is your client in these stages? Right? So incubation is that time period when the pathogen enters the body and the first symptoms occur. The prodromal stage is the time period where there's onset of general symptoms, but the findings are really, or the symptoms are very vague. So somebody might come into the office complaining about just feeling bad, feeling tired, fatigued, and they may have a low-grade fever, and they're in this prodromal stage. When they get to the full illness stage, that's when the client has findings or symptoms, signs and symptoms that are more specific to that infection. So if the client has an infection of the lungs, in this illness stage, they will have coughing, they will have sputum, they'll have more specific symptoms in this full-blown illness stage. And then the last stage is convalescent, and this is the period when those acute findings that you had in illness disappear and total recovery occurs. And in some illnesses, some infections, it can take days to months to actually recover and get out of that convalescent stage. This slide pretty much goes through just terminology that you need to be familiar with. I'm sure you are now more than ever very familiar familiar with that last terminology here, pandemic. So a pandemic is a worldwide epidemic of a disease, what we're living through now in COVID-19. The Ebola virus back in 2015 was an epidemic. So it's when the cases were more than normal. And actually in 2015, 2014, I think it was March 2014, the World Health Organization, the WHO, reported cases of the Ebola virus in southeastern Guinea, in the West African population. So Ebola is a Western African epidemic as opposed to our pandemic of COVID-19, which is a worldwide epidemic of the disease, of a disease. Our learning outcome number 6 is to recognize signs and symptoms of infection, and you will be doing that through your assessment of the client. Some symptoms of different infectious diseases vary significantly between and within diseases. So for some symptoms or some infections, you see visible symptoms. So you might see a rash or a redness or swelling. And these can be early warning signs of an infection. But in other infections, like tuberculosis or HIV, there's a period of time where there are no symptoms at all, and that's called an asymptomatic latency or asymptomatic period. Infection has to be determined through diagnostic procedures. So you have to remember, all of you got the PPD skin test before you entered nursing school, and that was, if you came back positive, that could diagnose a case of tuberculosis in somebody that wasn't exhibiting symptoms. So the health history to obtain information is important. It establishes the probability or the likelihood or source of infection. So in your Hinkle text, chart 71.5, there's some great questions that you as the nurse can ask the client so you're sure that you're obtaining thorough health history information. Things like, do you have a history or previous or recurring infection? Do you have a fever? If you have a fever, how high has that fever been? How long has it been going on? How about a cough? Are you noticing any dry cough, productive cough? Do you have any pain, any swelling, drainage? How about diarrhea, vomiting? This is a good one. What is your vaccination history? So that's going to tell us a lot about a patient or a client and their probability or susceptibility of getting an infection. Lastly, have you traveled outside the country, or what's your occupation? What do you do for fun? Maybe somebody's, out in the woods a lot, whatever it might be. But these are important. The health history will give you that information that will let you know whether your client might have an infection or is currently infected. You as a nurse will play a critical role in preventing and controlling infection. Okay, the role begins with that early detection and surveillance techniques. So your nursing assessment needs to be right on and needs to include observing for signs and symptoms of either a local or a systemic infection. So I've listed them out here so that you can see the difference. A localized infection will involve redness, swelling, warmth in the involved area, pain, tenderness, maybe loss of function of the affected part. Let me give you an example. My son, I'll tell lots of stories about him, but he is a bit of an adventuresome young man. Well, he was on a super yacht working as a deckhand, and he fell and cut his leg, cut his shin. He had a wound there that had started getting red. It was very tender. Edema is another word for swelling. You'll need to know that. So there was edema, there was redness, there was swelling at that wound. Okay, that was the localized infection. As his infection progressed, it became more systemic. So he got a fever. He had malaise or just general just be extremely tired, lethargic. He had, and I wasn't there to take his pulse or respiratory rate, but you could feel his lymph nodes were tender or enlarged. His appetite was down. Someone that is experiencing a systemic infection typically will have, along with that fever, will have increased pulse rate and increased respiratory rate. So those are the signs or symptoms of a systemic infection. Here I go again with those visual representations. This represents the cardinal signs of a local infection. Again, that localized infection, and it's the same thing as the inflammatory response. So, like I just said, my son's leg became red, swollen, painful, hot to the touch is another thing that you'll want to assess. Warm to the touch, difficult to walk on. These are cardinal signs of an acute infection, a localized infection. ATI has a great description of the inflammatory response. Make sure you read that and you understand this process. This slide depicts that first stage of the inflammatory response. Make sure you're looking at that ATI description. It's real important. So the inflammatory response has 3 stages. The first stage is when the body part will become red, wherever that infection is, will become red, will be warm to the touch, will have swelling or edema around the area, will be pain or tender to touch, and possibly not be able to use, if it's a foot, maybe won't be able to bear weight on that foot. The second stage of the inflammatory response is where you will see like pus or fluid draining from the wound. We call that exudate. So exudate leaves the body by draining into the lymph system, and you have these different descriptions of the exudate. So, and your ATI does a fabulous job of explaining this. This serous is the red fluid. Sanguinous has more of the white blood cells in it, and then the purulent is when you get that pus involved. Your third stage of the inflammatory response is when you have scar tissue starting to form. So new cells take on different characteristics, and they're similar in structure and function to the old cells, but the damaged tissue is replaced by the scar tissue, basically. We're still looking at that assessment piece of the infection concept, and it is real important for you as nurses to collect all the data. And a big piece of the data is the laboratory values that your clients have. So your laboratory data can provide further insight into the presence of the infectious process. In your fundamentals book, there's an excellent box, box 24-1, that goes into this laboratory data. So the most critical lab test to evaluate the presence of infection is going to be that complete blood count, your CBC. And with the CBC, you can either get a WBC, white blood cell differential count, or you can order a CBC without that differential count. When you have the differential count, it's going to give you an indication of what those different white blood cells look like, whether they're elevated or decreased. And elevated B and T lymphocytes and elevated neutrophils and monocytes are indicative of infection, and particularly a bacterial or a viral infection. Neutrophil counts are significantly elevated with a bacterial infection, and typically you'll see an increase in your band cells or those immature neutrophils, and that's when an infection is acute. If your client has an infection caused by a parasite, you might see an increase in your basophils and your eosinophils. So these are 2 different white blood cell counts that aren't typically increased if it's bacterial or viral. So that's how your healthcare provider, when they do these lab tests and how you can interpret them, to give you an idea or an indication on what is that organism that's causing the infection. It's going to be based on our evaluation, our medical management will be based on what this lab work looks like. Okay. You also have something called a CNS, or a culture and sensitivity. And when that is done, it gives us more information, or the healthcare providers more specific information on how to treat the pathogen. So it can be done on any body fluids. So typically you'll do a culture and sensitivity on a urine, on a throat culture, on any kind of blood you obtain. So you can do a culture and sensitivity on any of those body fluids. And again, it's really critical in treating the infection, because once those results get back, once the specimen has been identified, the organism has been identified, then we start to treat that with antibiotics if it is a bacteria. And then, and it goes into more detail in your book, and I'm not going to go too much more into it, but if you have a specific bacteria that's causing the infection, then the medical management will be an antibiotic that bacteria is susceptible to.
Now let's look at nursing diagnoses for the concept of infection.
The potential for infection, or the actual presence of infection in a patient, are nursing diagnoses. Remember, you're learning all about, this semester, we're learning all about the nursing process, or the ADPIE, ADPIE. And in this course, in your Wellness 1 and Wellness 2 course, our focus is going to be on that nursing care, your interventions. But your interventions and your nursing care is going to be dependent on your nursing diagnosis, which you obtain based on your client's assessment. Okay, so I hope that process is making more sense as you get exposed to it. So deficient fluid volume, risk for infection, readiness for enhanced knowledge, whether somebody is ready and willing to learn how to do a dressing change, or whether they are willing to understand and learn about correct hand washing. Now let's talk about our nursing interventions. Again, and I hate to keep pounding it through, but hopefully you'll get it. Your care or your nursing interventions are going to be driven by what it is you assessed and diagnosed in your nursing diagnosis, so based upon your assessment findings. Our second learning outcome is to describe the nursing interventions used to break the chain of infection. So we're going to look at these again, and we talked about them in that PowerPoint slide that had the chain with the scissors, right? So we talked about it a little bit there, but I want to also go into more specifics, nursing interventions, and what you will do as a nurse to help your client meet the goal of preventing infection, or stopping infection. So the outcome, or the goal, is for your client to prevent, is for us to prevent infection. Well, how are we going to do that, right? What are our nursing interventions that will help the client be free from infection? So let's dive in, okay? The extent of your nursing interventions are really going to depend on a couple things: the susceptibility of the host, how strong or the organism virulence, and your patient's signs and symptoms. What is your patient exhibiting? Primary prevention begins with the administration of vaccinations, right? So worldwide, administration of vaccines have made or eradicated infectious diseases such as polio, smallpox. Today, we have standard vaccinations that control the spread of diseases like influenza, tetanus, diphtheria, pertussis. You guys have had all of these injections or administration of vaccines before coming into nursing school. Infection control is defined by the World Health Organization as, quote, measures aimed at the protection of those who might be vulnerable to acquiring an infection. All right, so measures aimed at protecting those who are vulnerable and may get an infection. Okay, so the basic tenet of infection control is hygiene. So your hand hygiene, basic tenet. It's a critical component to the prevention of infection and the spread of disease. And we're going to talk about it almost ad nauseum a little bit later in this presentation. But personal protective equipment, PPE, and that involves all of these things listed here, your gloves, your masks, protective eyewear, any kind of infection or gown that would keep things from penetrating. You probably don't have your gloves or your masks on now, but when we're meeting face to face, we will have protective eyewear and we'll have masks on. Isolation precautions, we'll get into that in a good bit in the next couple slides. Sterility is sterile asepsis, again, talking more about that. Your medication administration based on the specimens or CNS, culture and sensitivity of your specimens. And then teaching about infection control. So teaching your clients how to stay free from infection. If we can limit the dissemination, they call it, or spread of the pathogens, if we can limit sharing those pathogens, then we will be able to decrease the transfer of the pathogens from person to person. Okay? The most practical way to do this is through the use of barriers that prevent the transmission of the pathogen. Okay? Barriers are the ways to decrease the spread of the pathogen. So look here in the diagram, hand hygiene, personal protective equipment. This is a really nice picture, again, demonstrating how those barriers break that infection cycle. And you, again, as the nurse, you need to understand these barriers. You need to understand these precautions so you can keep your clients and yourself safe and minimize the risk of infection to control the infection process. So your learning outcome number 7 is describe ways to manage an infection. And we, as a world, have been very successful in preventing and treating infections over the last century or so with the introduction of antibiotics, with the introduction of modernizing sanitation practices, public health initiatives, immunization programs. All of these have helped us prevent and treat infections. Our learning outcome number 7, describe ways to manage an infection. Our goal is to eradicate the infection or prevent secondary infections or limit the damage of those secondary infections to the body. So treatment of infectious process and support of affected body system, again, hopefully limiting the damage that's going on with the body. Effective hand hygiene was on our other interventions, cleaning, disinfecting environmental surfaces, and avoiding close contact where different bacteria or viruses can be shared. So I wanted you to note here that antibiotics are prescribed for bacterial infections. Antivirals are prescribed for viral infections, and there are antifungal agents that get prescribed for fungal infections. So when someone gets angry that they go to the doctor's office or healthcare provider and they don't get an antibiotic because they have a virus, we as nurses can educate them appropriately and that antibiotics do not treat viruses. Just like this COVID-19 virus cannot be treated by an antibiotic. Now, people that come in with COVID-19 might have a secondary infection that's caused by a bacteria, and therefore an antibiotic is ordered. But that information, the pharmacologic agent or treatment that will be prescribed is outside of your scope. So you as nurses cannot prescribe those treatments. The healthcare provider will prescribe that. But it's important for you to know about them and be able to safely administer them. So remember, we talked a little bit about that blood sample or body fluid that you would collect and send off for a culture and sensitivity. You as a nurse might have a patient, let me just draw a picture for you. So a patient comes in with fever and they're complaining that it burns when they urinate, they have foul smelling urine, it's cloudy, they have back pain, they have a fever. They're presenting, their signs and symptoms are telling us that this client perhaps has a urinary tract infection. So we will probably have a healthcare provider obtain a urine culture, and let's start them on a broad spectrum antibiotic. And you'll get more of this in pharmacology, your patho and pharm, but typically that's going to be your medical management in that situation. It's real important for you to know that you need to collect that specimen, you need to collect that urine sample before you start that antibiotic, so the antibiotic doesn't conflict or change the results of that urine culture and sensitivity, because based on that urine culture and sensitivity will help us determine help the healthcare provider determine what pharmacological treatment is the best option, if that is a bacterial. And if it's not, then what is our best treatment?
Now let's look at the risk factors for the concept of infection.
The body's white blood cells provide resistance to certain pathogens. So if the white blood cells are diminished or they're not functioning properly, like if someone is receiving chemotherapy or their white blood cell count is low for whatever reason, they may not be able to fight that infection. So they're more susceptible to that infection. I really want you to pay immunizations. So if a client has been immunized against an infection, then they will be less susceptible. If they don't have the immunization or the vaccine, they're going to be more susceptible. And we're going to talk more about the invasive or indwelling medical devices at the end of this lecture or towards the end, but the hospital-acquired infection, the HAIs, if a patient has an invasive line, so if they have a feeding tube, a central line, a wound drain, a urinary catheter, that's going to make them more susceptible to an infection. I want you to pay very good attention to these last two bullet points. You as a student nurse probably are a little stressed. You're fatigued. I don't know what your general health status was to come into nursing school or how your nutrition is, but you are more prone to get an infection, whatever that infection may be. Many nursing students get ill when they're in nursing school because you're so stressed and you have so much going on, where you really, especially this first semester of nursing school, try very hard to keep yourself healthy, especially now with the COVID-19 running rampant. Try to prevent fatigue, try to prevent poor nutrition, try to de-stress so that you are not a susceptible host and you do not get an infection in your body. So as a nurse, you want to assess your clients for risk of infection specific to the client, all right, or to the environment or the disease. So someone who has inadequate hand hygiene, they don't wash their hands after going to the restroom, or they don't wash their hands before they do their dressing change, they're at a higher risk for infection. People who have compromised health or their defense systems are compromised. Again, well, these are great examples. People who have had surgery, anybody who has an indwelling catheter device, if there's a break in the skin, someone who has poor oxygenation or impaired circulation, which might be any of the individuals on the next bullet point, somebody with diabetes or chronic lung disease, kidney failure, liver failure. All of those individuals are more at risk to developing infection. Caregivers using medical or surgical asepsis that don't follow established protocols. So what that means, guys, is if you are trying to apply those sterile gloves that you will be doing in skills lab and you contaminate them. Or you're administering a vaccine, or you're giving a medication and you don't clean the port, or you don't clean the skin. Those are ways or risk factors that can cause an infection. And I know y'all went into nursing school and you're going into nursing to help others. The last thing we want to do is be the cause, because of our practices, our actions. We don't want to cause an infection, right? So this is a little bit repeat. Clients who have poor hygiene, poor nutrition, those who use excessive alcohol or are under a lot of stress are more at risk of infection. Clients who live in a very crowded environment. So when COVID-19 first hit, the places like New York City and downtown Atlanta, the places that are very crowded have more infection cases. Those that don't have the money to either have preventive health care, do vaccines, or maybe they get so sick before they seek care because they can't afford it. Poor sanitation, mosquito-borne diseases, those are all clients who have been exposed to those, all risk factors that will impact whether a client catches an infection or has an infection, catches a disease. The other risk factors I want you to be aware of are age, right? So the infants or newborns that have immature immune system, thin skins, they're more at risk. Thin skin, they are more at risk for infection. The older adult, and now when I say older adults through this PowerPoint or through the course, we're talking people over the age or 65 and older. So we used to call them elderly, but now we call them older adults. And I am appreciative of that. I'm not anywhere near that, but the elderly sounds kind of derogatory. So the older adult is more at risk for infection, and you need to be aware and you need to know why, right? So the older adult has different physiologic changes that will make them more susceptible. They age-related loss of skin tissue, subcutaneous tissue, their skin gets thinned. They're less responsive to antibiotic therapy, or it takes them longer to fight the infection for the antibiotics to get in their system and show a response. Their immune response is slowed. Because of their vascularity, so their vessels in their body and the blood is not perfused as well. So the decreased vascularity impacts how they are able to fight infection, how it also impacts the wound healing. So the wound healing is slowed. The older adult also has decreased or less gag reflexes, decreased cough, which can then cause them to aspirate and get an infection. Typically, an older adult will have more chronic illnesses than the younger adult. This puts them at more of a risk for infection. They don't move around as much, so decreased mobility. They can have bowel and bladder incontinence, which can cause urine or a urinary tract infection, dementia. So a lot of times they don't, people that have dementia don't bathe as much. Their hygiene is worse. And again, when someone is older, along with those chronic illnesses, they might have a higher incidence of having a feeding tube or urinary catheter. And those foreign objects in the body will cause them to be in a greater risk for infection.
Now let's look at health promotion for the concept of infection.
Our learning outcome number 5 is to identify factors that reduce the incidence of HAI and UTI. So HAI, remember, is hospital-acquired infections. UTI is urinary tract infection. So if you remember back on the second slide of this presentation, the two of the exemplars are hospital-acquired infection, urinary tract infection. So we're going to go into more detail about these two areas. So Back in the day, so just in case you've heard nosocomial infection, that's the old term for an HAI or a hospital-acquired infection. Um, Despite our best efforts as healthcare professionals and our colleagues, we will have infections in the hospital. We just will. Infections happen because of that infection chain we've already gone through, but we need to try very diligently, not just try, but we need to be diligent in our techniques so that we can minimize these hospital acquired or healthcare acquired infections. So how do we prevent healthcare associated infections? So I want you to realize that there are your textbook talks about two different types of healthcare associated infections causes. So the causative organism acquired from other people is exogenous. Endogenous is within the person. So we all have normal flora and have different bacteria within our own bodies. So those are just a distinguishing factor of the healthcare infections. Iatrogenic is also a term that we use that means when an infection is a result from a treatment or a diagnostic procedure. Okay? So major challenge for hospitals, for healthcare providers, is to prevent these infections. It's extremely costly for the healthcare systems and not good for our clients, not good for our outcomes. And they are preventable because if we do things, if we promote practices that minimize bad procedure, I guess, I don't know how else to say that, then we're going to hopefully prevent those infections from happening. So most of the HAIs are caused by bacteria. I've listed them here. And most of the HAIs are caused by urinary tract infections, and specifically catheter-associated urinary tract infections. You'll hear a term called CAUTIs, catheter-associated urinary tract infections, and they're the most common types of our healthcare-associated infections, and almost 80% of these are associated with an indwelling urinary catheter. So those Foley catheters that are causing these infections. So your book, your Hinkle book, talks about Healthy People 2020 and the U.S. Department of Health and Human Services, a joint commission. And a lot of different agencies have coordinated strategies to help reduce the healthcare associated infections. You'll hear the term bundles. This comes from looking at evidence-based best practices and creating strategies to promote positive outcomes for your clients. So when they're implemented together, when the strategies are implemented together, we're hoping, or it's actually proven, to decrease the occurrence of the infections. So this is things like getting the urinary catheter out as early as possible, making sure that only certain people change the central line dressing. And you can read more about the specific bundles and what that looks like in your textbook. But measures to reduce these infections. We now have a mandatory reporting system where agencies report the data on their websites on how many healthcare acquired infections they have had this month. I think it's typically by month that they report these, so that the community, the public, can go to these websites and see how safe it is to get healthcare at these facilities. Other ways that healthcare systems are preventing these infections. by having written infection prevention practices for all personnel. And not only is it written, they are making sure that they are followed. They're constantly watched by infection control committees, and we have nurse epidemiologists that will round and see where those infection numbers are coming from and why are they higher, right? So do we have these protocols in place? And if we do, then where's the disconnect, or or what do we need to change, right? So hand hygiene recommendations, infection control precaution techniques, keeping patient in the best possible physical condition. That last bullet really goes to that susceptible host piece. So if that host, the individual, is stressed out, has poor hygiene, doesn't have good nutrition, then they will be more susceptible to get any infection. So we want to make sure that we keep our clients as healthy as we can. And these are all measures to reduce the healthcare-associated infections. So remember I talked about how the creation of antibiotics and immunizations and cleaner environment has really helped in the past century decreasing on infection. Well, it also has caused or created a situation where our bacteria become resistant to the antibiotics that are prescribed. So you're going to learn a lot about multi-drug resistant organisms and pathoforms. So I'm not going to go into too much detail, but this specific, you will hear of MRSA, or methicillin-resistant Staphylococcus aureus. That's why we call it MRSA. You'll hear a lot about that in pathoform, and you'll hear that when you're in the hospitals and healthcare settings. These are easily transmitted from healthcare worker to the patient from the skin, right? So these are healthcare, or they can be community acquired transmission. And that mode of transmission, again, remember back to that chain of the components of the infection cycle, is through direct contact from the contaminated hands onto equipment or onto the clients. But this trend of this microorganism that's resistant to the antibiotics is a big challenge and is a huge impact in caring for our clients with infection. So the next several slides, I'm going to spend talking about hand hygiene. In lab, you'll be discussing this a lot. You'll not only need to know this, but you will need to practice it as well, especially in today's environment. Here, this picture shows you 5 moments for hand hygiene. So in these 5 times that you care for your clients, you need to make sure that you are washing your hands or having good hand hygiene. Before you touch your patient, so now they have the foam inside the patient's rooms so that the clients can actually see you put the hand foam on your hand and wash your hand, or you go to the sink and you wash your hand prior to touching your patient. Before clean or aseptic procedures. So you're going to assess someone's IV, or you're going to obtain a temperature assessment. So you're going to wash your hands, good hand hygiene before you do that. After body fluid exposure or at risk of exposure, you're emptying a Foley bag where the urine is, or you're picking up a tissue that has sputum on it. You will need to wash your hands. After touching the patient, after touching the patient's bedside table or IV pump, all of those are times or moments when hand hygiene is not only recommended, but it is a necessity, okay? Another big thing I want to make a point here is about your hand hygiene is you always go from clean to dirty, not the other way around. So what I mean by that is if you're assessing a client's IV, so if you have to assess your client's IV and also assess a wound, You would wash your hands before touching your patient, assess the patient's IV, and then assess the wound, then wash your hands. You would never, ever, ever assess the wound, which is dirtier, then go to the IV. So you don't go dirty to clean, you go clean to dirty. And we can talk more about that if that's not clear, but that's a huge point in infection control and hand hygiene. In your fundamentals book, you will see that there is skill 24-1, performing hand hygiene using soap and water. Please read this, please know this, please practice this. You have to have friction when you're washing your hands. You have to provide friction for at least 20 seconds. Sing the happy birthday song, sing whatever song you want, count to 20 out loud. However you do it, it's up to you. Make sure that you wash under your fingernails. The big places where nursing students who are just learning or individuals who don't know the techniques of hand hygiene come into problems would be turning off the faucet. So a lot of times I'll see, I'm in simulation too, so we get to watch in simulation how people do their hand hygiene. Let's say that you have just washed your hands. You need to make sure that you turn the faucet off with a paper towel, because after you've scrubbed your hands, you used the friction, gotten all the germs off of it. If you touch the faucet again with your bare hands, you're recontaminating your hands and have to start all over. So you wash your hands, you leave the water on, you pat your hands dry with the towel, clean towel, you discard that, and then use another clean towel to turn off the faucet. Now, warning here, this is where some students have a tendency to recontaminate their hands, is after they use that clean towel to turn off the faucet, then sometimes they wad it up in their hands and throw it away. Think about that. So you've just used a clean towel to turn off the faucet, and there are germs on the faucet, and then you grab that towel and wad it up, then you've just contaminated your hands. Okay, so make sure that you practice these good hand hygiene techniques in the lab, in your daily life, forever and ever. Amen.
This is actually a skill in your Taylor skills book. And I know in the skills lab we'll be going over proper hand hygiene, but these are the pictures of the proper hand hygiene.
So the question, when do I have to wash my hands? The answer, if your hands are visibly soiled or contaminated with blood or body fluid, you have to wash your hands. Use an antimicrobial soap to do so. Before you eat, after you use the restroom, you have to have at least 20-second scrub with plain soap or disinfectant and warm water. Hands that are visibly soiled need a longer scrub. You can use alcohol-based hand rubs, or we call them foam. We sometimes say foam in and foam out. And you can use this technique when your hands are not visibly soiled. Again, it can save some time. A lot of times it's right there at the door when you walk in the patient's room. It's easy to use. A time when you cannot use this, and this is real important to know, is if someone has been infected by that C. diff infection. C. diff is not killed by the alcohol, so you must use soap and water to wash your hands if somebody has C. diff, not the foam. Here are some more clinical situations when you can use alcohol-based hand rub or foam to decontaminate your hands. Before direct contact, after direct contact with patient's skin, after contact with body fluids, non-intact skin, and wound dressings if your hands are not visibly soiled. Now, if you pull your hand away from somebody's wound dressing and you've got exudate or blood on it, you have to use the soap and water. After you remove your gloves, you always have to wash your hands. You can use the foam in that situation. before putting in any kind of device, you can use the foam. If it, and I say any device because you wouldn't actually be doing surgery. In surgery, they have to use soap and water. Before donning your sterile gloves prior to inserting any type of, and they say central catheter here, they're meaning peripherally inserted catheters, the PICC lines. If moving from a contaminated body site to a clean body site during patient care, I just mentioned that. If you are assessing a wound and an IV, if you want to go from the wound to the IV, then you need to wash your hands, and you can use alcohol for that. Okay.
Another picture on how to hand rub.
Welcome to nursing school. Say goodbye to your beautiful French manicured nails. You have chosen a profession where we do not have beautiful hands. All right. That's just all there is to it. You're not allowed to have artificial nails. There are a lot of studies, evidence-based research out showing how bacteria and germs collect underneath those longer nails. You must have your nails clean cut, 1/4 of an inch long, so that you do not transmit organisms to your clients. Okay, hopefully I have hammered home the hand hygiene before moving on to our next learning outcome. Our next learning outcome, number 8, is to describe strategies for implementing CDC guidelines for standards and transmission-based precautions when caring for clients. Okay, so let's dive a little bit more into these precautions. So standard precautions is tier 1, if you will. It must be used with all hospitalized clients, regardless of their condition, regardless of whether we think they have an infection. It applies to all body fluids, all blood, secretions, anything, whether or not blood is present or visible, okay? And what that means is we treat everyone as if they have an infection in this standard precautions, okay? So they've added to standard precautions, they've added respiratory hygiene, cough etiquette, safe injection practices, use a mask when performing high-risk prolonged procedures, such as spinal taps. But basically, standard precautions is you wear gloves when you are in contact with body fluid, and you treat all body fluids as if they were infectious. In addition, not in replace of, but in addition to the standard precautions, there's going to be situations that are going to call for additional protective equipment. And we call that PPE. Our personal protective equipment is shortened to PPE. And we're going to go into more detail on what the transmission-based precautions are. So there's airborne, droplet, and contact. And we're going to go into that in the next slides. So these slides for the transmission-based precautions have a lot of information on them, but I want you to think through the infection cycle and think through it, right? So if a disease mode of transmission is airborne, then you must protect yourself and others using PPE that's going to prevent these secretions from coming out the mouth and nose, right? So somebody that has has tuberculosis, has chickenpox, measles, SARS, COVID-19, all of those are respiratory infections. For those individuals, they must be put in negative pressure rooms, which means the air is circulated within and there's filtration that keeps the air in that room, door closed at all times, and the patient has to stay in the room. The the healthcare providers that enter the room have to have an N95 mask on if the patient has tuberculosis. If a patient has measles or chickenpox and they're in airborne precaution uh, rooms, and someone entering the room has already had the chickenpox or the measles, then they can wear a regular mask because they've already been immune to these diseases because they have the vaccine. Patients in airborne precautions have to be, if they have to be transported out, they try really hard to leave them in the rooms, but if they have to be transported out, they have to have a surgical mask on the patient. Droplet precautions are used for patients that have an infection of a larger particle droplets, and ATI says larger than 5 micrograms. Again, I don't know how you would measure that, but people that have rubella, mumps, diphtheria. In kids, there's a virus called adenovirus. Those are all droplet precautions, disorders, diseases, infections. Typically, these patients are going to be in a private room. You may leave the door open, which is a difference from the airborne precaution. When you enter these rooms, you have to wear PPE upon entering the room for all interactions with the patient, okay? The patient in droplet precautions can be transported out of the room when necessary with a surgical mask on. And contact precautions are used for those individuals who are infected by that multi-drug resistant organism like we talked about, the MRSA. The RSV is contact precautions. Shigella, anybody that has a skin infection like impetigo, a wound infection, Shigella, scabies, herpes simplex. The patients have to be in a private room. You have to wear PPE upon entering the room for all interactions. Very important for you to change your gloves after having any kind of contact with the infective material, like if you're changing bed linens on somebody that has impetigo or, anything like towels. And you have to remove the PPE before leaving the patient room. Wash your hands with the antimicrobial or waterless agent. We really want to limit these people from leaving the rooms and avoid sharing patient care equipment. So you'll see the disposable stethoscopes, disposable thermometers, or individual thermometers in these patient rooms. I think I took this from ATI, and this is just, it shows the precautions side by side. Make sure you realize that a protective environment is an intervention. It's not a precaution. So these things are transmission-based precautions. But if you have a client that's immunocompromised, like somebody who's just had a transplant or somebody on chemotherapy, they will be placed in a protective environment. So they will be placed in a private room. They will have positive airflow and filtration for their room, and they will wear a mask whenever they're outside the room. So it's more like, I hate to say a bubble, but you're trying to create a bubble for that patient. So that's an additional, that protective environment is a little bit different. But this is a slide that depicts the transmission-based precautions side by side, comparing. Our learning outcome number 9 is discuss the techniques for medical and surgical asepsis. So asepsis is defined as the absence of bacteria, viruses, and other microorganisms. Aseptic technique includes all activities to prevent or break that chain of infection. And there are 2 categories. You'll hear clean technique or sterile technique. Medical asepsis is the same as clean technique, and surgical asepsis is the same as sterile technique. So clean technique includes practicing good hygiene, keeping anything that's soiled away from your clothing. For example, you've just changed bed linen and you don't hug it to your chest, getting everything that's on that linen on your clothing. You keep it held out away from you. When you're changing the bed linen, you don't throw the sheets on the floor. You don't put anything on the floor for that matter. Do not cough on others. Clean items with a motion away from your body instead of like dusting something and bringing the particles towards you. You don't ever want to do anything that physically raises the dust. And again, that's something, for example, just to put a visual in your head, like putting a sheet on a bed. You don't ever want to raise it up high and do a parachute out of it to prevent the dust from floating up. Practice clean to dirty. We talked about that already. Dispose of soiled or used items directly into the appropriate container. So if somebody has a dirty tissue, they're not just leaving it on the table, they're putting it right into the trash receptacle. Dispose of liquids directly into a drain to avoid splashing. If you're emptying a catheter or you're emptying a chest tube, you're going to want to make sure that you pour that into a drain and you try not to splash that particles on you. Good personal hygiene and following that standard precautions and those transmission-based precautions are all techniques that are going to be within that medical asepsis category. So part of being a good nurse is also being able to teach or educate your clients so that they can stay healthy at home. So here are some examples of medical asepsis or clean technique at home. Basic stuff that I hope you already know, but washing your hands before you're preparing food, making sure that if you're cooking something that requires a 300-degree oven, 400-degree oven, it's at the right temperature to kill the microorganism. Cleaning the cutting boards and utensils afterwards, keeping your foods refrigerated that need to be refrigerated, washing your fruits and vegetables, washing your hands after using the bathroom. Again, just some basic healthy hygiene, clean techniques that you want to make sure clients use at home. Aseptic technique is sterile technique. So this is when in lab you're going to learn how to don your sterile gloves. And there's a great picture of that on this slide. You will be using surgical asepsis sterile technique if you are working in an operating room. Labor and delivery areas have the sterile technique. Certain diagnostic testing areas like in interventional radiology. Sometimes the healthcare providers at the hospital will be putting a tube in at the bedside, whether it's a chest tube or something. Putting in a urinary catheter, you will be doing that, doing a sterile dressing change, preparing and injecting medicine. All of that is sterile technique. So you'll be performing sterile technique to minimize infection in all of those areas. Some basics about surgical asepsis is anything that once you touch something sterile, it is no longer sterile. So only sterile touches sterile. Everything else is contaminated. You will find that the outer edge of a sterile field, that outer 1-inch edge is considered contaminated. The outside package of a sterile package is contaminated. If you have accidentally soiled or made your sterile field wet, that is then contaminated. Sterile objects that are held below the waist level are contaminated. You have to, in order to keep with that surgical asepsis, the sterile object needs to be at waist level or above. This is pretty obvious. If you talk, cough, or sneeze into a sterile object or sterile field, it is no longer sterile. Never walk away or turn your back on a sterile field. I had a nursing instructor way back when I turned my back on the sterile field. She threw a dollar bill on the sterile field to make a point that it is no longer sterile. And that is basically just common sense. If you turn your back to the sterile field, you don't know if anybody's touched anything, anything's flown in there. So if you turn your back on a sterile field, it is no longer sterile. Keep all items sterile that are brought into contact with broken skin, used to penetrate the skin. Oh, okay. So what this is saying is, if you are injecting somebody with a needle, if you are putting anything into the body, those items have to be sterile. Consider any object contaminated if you have any doubt as to its sterility. That is just the drop the mic point right there. The last learning outcome number 10 is to demonstrate appropriate techniques when donning personal protective equipment. This is a skill you'll learn in lab. It's one that we'll probably do in class activity. It's a very important one to master. So make sure that you understand the proper technique in donning your PPE. I have a picture here, but it's really a kinesthetic learning point. We can't talk you through it. We need to actually do it.
And interrelated concepts for infection.
You all have been very patient listening to my voice through this entire long PowerPoint. I want to wrap it up here, as we always do, with our interrelated concepts. Again, remember, we are teaching you in a concept-based curriculum. So any concept we teach you, we want you to be aware of and think about the other concepts and how they relate. So our concept today is infection. It's in the middle here. It's got the red lettering, and you can see the interrelated concepts that are aligned to infection. The concept of infection is aligned with several concepts that we'll be learning throughout the course and throughout our nursing program. Immunity and inflammation is critical in providing a level of alertness or early identification of the pathogen that comes into the body. The immune system is the first line of defense against infection, and it's the body's primary method of response to that organism. Okay, inflammation is that part of the body's response to a foreign antigen, right? So again, you have that body's inflammatory response, the redness, swelling, and pain in that inflammation piece. So you see it's kind of overlapping infection. There's not even an arrow there because it's really, they go hand in hand. Tissue integrity, that concept is critical to avoiding infection. Remember, the skin is the largest component of the immune system. It's that biggest barrier. So good tissue integrity, skin integrity is important in impacting infection. Stress, I hope you've heard that throughout, that whether it's physical, emotional, or environmental stress, it'll challenge your immune system and it'll make the client more vulnerable to infection if stressed out, if stressed. And lastly, nutrition. So we need to maintain good nutrition. Good rest is also necessary for the body to be able to respond to infection and also support that immune response. So hopefully that you get a feel for how those concepts, the nutrition, tissue integrity, immunity, stress, and inflammation all are impacted by the concept of infection. Thanks for listening. Take good care.